Hey, Dr. Lindsey here. I'm here with Wendy, who's been here with me for 23 years. Right here's a picture of Wendy at her largest, and I had her lose weight, and she has still looks fine. We did a little tune-up on her 10 years ago, and she's going to turn 50. And Wendy's of the opinion she needs something done. I don't really think she needs anything done, but she has got a little bit of sagginess here. And nothing really in her neck. I think I did a good job on her neck, and you've stayed skinny. And so we're gonna do a little short scar facelift, really just in front of the ears, and we're gonna do something like this. And we're gonna do it under local anesthesia. Wendy's a diabetic. You can't pull too hard. She's got to take her antibiotics afterwards. And so we'll film different parts of this procedure. So here's Wendy's drawing, and we're going to put the cut in her preauricular wrinkle that almost every white woman has. And you come up a little bit to the top of the ear, and then out into the sideburn tuft. Under mine out to about this far. I tried to convince Wendy that we need to put this off or do something different and come out and do a little more pull out this way. But with her diabetes, I wanted to not have her look like somebody that's completely transformed. We'll do this, we'll pull up on the tendon that holds her face together. That little line right there is for the nerve that goes to the forehead and lets you move your forehead, raise your eyebrows up and down. Goes. And so that's where you have to be very careful. And want her out of here. And I don't think really much needs to be done behind the ear. She's pretty crooked if you look at this side. That sideburn is really significantly lower than the other side. Okay. So we just put a little numb medicine in. These typically hurt a little bit. Wendy's tough. How much did that hurt, Mama?
Just a...
What did you say?
Just a break.
That one gets you, probably.
Yeah. I don't think it hurts as much there because I've never been... Oh, yeah.
Yeah.
And now I know when people say, did I get something in my ear? When it numbs it, it makes it feel like there's something in the ear.
It does, yeah. The second side always hurts more than the first.
I know. The second side always hurts more.
Raise the ear up a little bit. So this side is done. Raise your eyebrow up and down. And it's down nice and flat, and hopefully we got a good change. All right, stand back, no 100%.
Am I even?
So there's no fluid on either side. It's not a huge change, but the cheeks are pulled up. Raise up your eyebrows a little, wiggle them a little bit. Perfect, yep, no troubles. How much did it hurt? You can be honest.
No, that doesn't hurt at all.
Okay, all right. So we just got done, and how much did the whole thing hurt? You can be honest.
No.
One little pinchy spot on the right?
Yeah, that was at the end. Yeah.
Yep. And you've wrapped up about 3,000 people with me, so you wrapped yourself up.
Yes.
And you're going to go home and you're going to take your antibiotics.
Yes.
And probably a pain pill, and we're going to check you tomorrow and film an addition.
Yeah, we'll just remove the wrap.
Okay. Hey, Dr. Lindsey here on day 1 after Wendy's little short scar mini lift yesterday. Again, I didn't think she really needed anything. Wendy looks good to me all the time. We'll video this throughout the next week or two. How much did it hurt yesterday, Wendy?
It didn't hurt at all. I did not wait for it to hurt. I took a pain pill at 6 p.m. And then another one probably like around 1 a.m. And I haven't had any Tylenols or pain pills.
Did you have any bleeding or anything?
None. Right after when we were done, it had a little bit of bleeding, and I removed my wrap this morning to shower and come to work, and it was just a tiny little.
All right, well, let's take your wrap off and show people what you look like. For you customers that might do this, I don't want you to take your wrap off to look at it. I trust Wendy to do it because she's helped me with 4,000 of these things. So this is, scoot a little closer, turn that way. I'm going to lower this a little bit. So here we are. Her earlobe has got a little fold in it. I'll pull that back. I cut one from here to
yeah.
here. This is where I worked. It's laying down flat. You push against it, and there's good capillary refill, which means there's good blood supply. Didn't pull too tight. Turn the other way. Same thing over here.
That's the side that it was.
Yeah. And then look right at the camera. And so you're a little swollen. Tomorrow
cheeks,
you'll be a little worse. And then the swelling will go away.
Yeah.
Okay. Pucker up, smooch for the audience. So raise up your eyebrows. Yeah. So everything works good.
Yep. Mm-hmm.
Anything you want to tell people?
No, I mean, I think this is a great option for, if you have like little jowls that bother you.
A little pick me up without going through a big.
Exactly. Yeah, and that's the good thing. It's like, today I'm at work.
Yeah.
And it's not that I have not, and it hasn't hurt. It's just sore.
And normally I would have people not wear a head wrap today, but Wendy's diabetic.
And I need to wear.
And I wanted to wear a head wrap for about 2 more days. But
yeah, normally it would be, you'll be done.
Because we didn't do the liposuction.
Yeah, we didn't.
Yeah.
But this, I think for me, it was either do what is in style now. How do you say it? Like, for me, it would either be doing what they're doing now with the fillers and putting it here, but I think it would stretch this more, and it was better to have this. And it's not a huge change, but I had it done when I was 40, and then now I'm turning 50 next month. And for me, it's just, I think it just helps me to stay, the tissues stay in place, and it doesn't.
It's like maintenance.
Yes, it is like maintenance. Yeah. And it's not, like I said, it's not like a big. Yeah. It's preventing from having like a big facelift, I think.
Yeah.
I like it.
I mean, there'll be a day eventually where
I need a big one, yeah.
Mm-hmm.
Yeah, like you said, probably doing a higher. But I'm happy with this. Right. I'm really happy.
Okay. So here we are at day 6 after doing this, and we just took Wendy's stitches out, turn a little bit, and so that's what it looks like. Let's get a little closer. Look straight ahead. So that's what it looks like at day 6, and she'll put vitamin E and massage the sinks, and it'll flatten out. If you put it together perfectly flat, as it goes down, it gets a little divot, so it's a little ridge, and turn the other direction. And you wore a wrap for a few days. You can turn back. How much did it hurt?
None.
And you're 50.
Yes.
And at some point when we edit this video, I'll put pictures up of you 20 years ago when I first met you, or after I'd known you for a couple years. All right, well, we'll have an update in a week. Thanks. Now it's been...
the 26th? August 26th was my procedure.
Really? So now it's been 7 weeks since we did Wendy's procedure. And she's been on vacation. Another one of her many multi-day week vations, and I was out of town, so she had another week of rest and relaxation, and so that may account for how good Wendy looks at this point. And so what do you think, Wendy? It's been 7 weeks.
Yes, I love it. People would say I didn't need it.
I would agree with that. I don't think Wendy needed it.
I had some jowling and
come closer to the thing.
So I had some jowling, and this doesn't have it anymore. And if you were to pull,
I mean, so I can't really pull anything. So you stayed tight.
Because we went here. Yeah.
I don't think I don't think your eyes look like they've been made distorted.
No.
Can you get a close up of your scar? Come scoot close. You look straight ahead. This is 7 weeks.
And it's all the way up here.
Yep. And turn the other direction there. A little closer this way. Yeah. All right.
And we didn't do anything on my neck. It was just
we had done that
nothing.
10 years ago.
Exactly. Yeah. And it was this part in the front.
Okay. You've helped me on a couple thousand of these things.
Yes.
A lot of times we end up talking we did a nicely shaped 71-year-old last week. Looks like you accept 71 instead of 50. But she'd seen 3 or 4 different doctors who said she needed a deep plane facelift for 40 or 50 grand, and we did this.
Her. Yes, and she looked amazing.
Yeah.
Like, I wish I had a little bit more jowling, and we had decided that, that I could wait for it. I didn't want to wait.
But you wanted it for your 50th birthday.
I wanted it for my 50th birthday, but that made exactly 10 years after
the last time
you did it. And I'm super, super happy. People say, oh, there's not much difference. So there's not much difference because I didn't need a drastic change. This lady was, when I saw her, she's like as pulled as I look, and she's
71.
And she looked perfect. I was like, oh my God, you look so pretty.
But she's not too pulled. Like every day, once a week at Safeway, I see a lady that's your age or my age who looks like they've been in a wind tunnel.
Yeah, and then so when you go like this to me, you're like, oh, you can pull more. But people don't understand, like, I can't pull my skin anymore.
Right.
Like, really, like, you can't. Like, it's impossible unless you do a deep plane facelift, like you said. But doing a deep plane facelift for somebody my age, which is 50, a lot of young girls are getting that done. Yeah. You're pulling it to the point where it's like, it changes your features.
It does. And I don't think you ever look like you once did. And remember, a long time ago, we did a really good looking lady, it was about 50. And we did exactly what you did. And she went from plain Jane to super mom. And she loved it, and all her friends. And then her husband didn't like it because she got so much attention.
Yes.
He wanted us to undo it.
Yeah. And
that was a good result. So if you take a woman who looks pretty good and make her look funny looking, I think that's not good for people.
Yeah, and it's what you like. And, there's, with a mini lift, what I did, the cost of it really is like 2 times going and getting that new thing that they're doing. Like, how do they call it? Like, when you get all the fillers in the jaw to make it straight and all those things. But I know, being in the industry, that will stretch the skin more. And you're basically paying for a mini lift. You're holding up, if you're young, like if you're mid 40s or early 50s, you're removing that excess skin, so you're not gonna age as quickly as you would do if you have not done
just
anything.
The skin, you're pulling the muscles up.
Pulling the muscles too. So my muscles are really tight. Like, when you can see the movement, it's on the skin, but I need it to move. Yeah. So it is like that. I think I like mini lifts, and like I said, I have the option of really almost getting everything at a cost, or almost at no cost, to get fillers and stuff like that. I wouldn't pick that. I can do anything really, the mini lift, because I think it's the one that will give me more bang for my money.
That's right. And you still look normal.
Yes.
I don't think you look 50, but I don't think you look 50 beforehand. But when you turn 60, I think you'll still look like you're like 50,
Yeah, and nobody's gonna say, nobody has said, oh my God, Wendy looks like so, weird looking because she had so many procedures done.
Yeah.
I had many procedures done.
Yeah.
My nose, my lower lids, but they're natural. They were done by you.
All right. Well, this concludes our long extended video of a short scar facelift. If we can help you, give us a call. Thanks.